Simply speaking, pilonidal disease is a disease where normal hair is forced under the skin and causes chronic inflammation, infection, and chronic drainage. This is most commonly seen in the natal cleft, or the crease between the buttocks. Because of this natural crease and the walking motion, it forces hair under the skin and sets up this chronic inflammatory reaction. This is more commonly seen in people with a lot of body hair and is more common in men than in women. The symptoms of pilonidal disease can range from totally asymptomatic to symptoms of chronic or local infection. You may not even be aware that you have pilonidal disease, but the most common way that it presents and causes symptoms is swelling and pain in the natal cleft or the crease between the buttocks. This can manifest itself as pain, fever, or chronic drainage. Although pilonidal disease may be largely asymptomatic at times, one of the signs that you may be at risk or be developing early pilonidal disease is the presence of small holes or pits in the natal cleft or the cleft between the buttocks. If you're being examined by your doctor or have some chronic drainage in this area, they may notice these pits, and that is a sign that you are at risk for developing infections related to pilonidal disease. Pilonidal disease is not a life-threatening problem, but it certainly is a life-irritating problem and should be treated appropriately. There are three broad categories of the treatment of pilonidal disease. The first is really aimed at prevention of a flare-up, and that really involves meticulous cleaning of the area and, very importantly, trying to remove the hair from this area, either with depilatories like Nair or shaving or even laser hair removal. If, however, you do get an acute infection, like any infection, the initial first treatment of this is drainage. And you can see your local colorectal surgeon to see if that can be done as simply as in the office. However, the treatment of chronic pilonidal disease sometimes requires a little bit more aggressive treatment. This treatment is aimed at not only removing the chronically affected area, but also changing the anatomy so that the conditions which lead you to develop recurrent infection are removed. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colorectal surgery, and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.